Bismillahirrahmanirrahim. Iyyaka na'budu wa iyyaka nasta'in. Allahumma salli ala Muhammadin wa ala ali Muhammadin wa barik salli alayhi. Dear colleagues, this is a young male patient with history of pain in the right iliac fossa for the last 3-4 days. So I'm going to scan the abdomen with a linear probe, suspecting that it may be appendicitis. So I'm going to scan it directly with a linear probe. So I have placed the probe in the right hypochondrial region. So here we can appreciate this large segment of the large bowel. And this gap which we feel, this one and this one, these are the hastration of the large bowel, and these fossae echogenic with posterior shadowing, and also dirty shadowing is present, and also we can appreciate this artifact which I don't remember the name, this one. So these are the gas bubbles within the large bowel. So now I am dragging the probes lower and lower. Still, now this is the small bowel, while I have placed the probe now at the right paracolic gutter. Now gradually I am coming down. This is the, now I have reached the right lower quadrant. This is the segment of the cecum, and now I am going to move the probe in sagittal section. So this is the region, this is this one at the lateral side on the screen. This is the cecum, the loops of cecum. So okay, I will highlight it. This is this one, and here if you closely observe this structure, this one at its, this is the cecum, and this structure is appendix, which is just medial and slightly posterior, and this one is the, this is the cecum, this is the small bowel, this ileum which is the attached to the cecum, terminal ileum, and this one is the, this one is the appendix. So it is inflamed at its look. Walls are thickened, and the lumen is filled with the debris and echogenic material. So now I am going to highlight is further. Now I am checking the other bowel loops of the ileum, and now I have reached the McBurney point. So this is the McBurney point I have reached, and here we can appreciate this one. This is the appendix. This is the appendix. This one, you just can appreciate that how it is located superficially. This is the skin. This is the internal oblique, internal, external, and transverse abdominal, so three muscles of the lateral abdominal wall. And look at the distance from the skin to the appendix. So okay, I am going to measure it. Here we can appreciate that it is 7.1 millimeter. It's the distal end that is floating. I am not talking about the base. Distal end is floating just near the surface of the skin. This is 7.1 millimeter deep. So how it is located superficial? So I am going to I'm now going to see its base. So look at here. This is the appendix, its proximal portion, and this is the base of the appendix, and this is the cecum. Appendix is at its posterior and medial aspect, and this small portion of the gut loop is terminal ileum, that is passing anterior to the appendix. So this was the, as I was suspecting, this was the case of appendicitis, and now I want to see this one. This is the distal portion. Look, it's surrounding, thickening, and if we put the color, you can appreciate the hyperemic blood flow. And now I am following its distal end. Minimal fluid is also seen, inflammatory fluid. I am now going downward, and this is the distal end of the appendix. So how it is significant, long enough. Also the diameter is a significant increased. How it is long, starting from here to here, over the muscles, over the all structures near to the surface of the peritoneum. This is the peritoneum, and this is the lateral abdominal wall muscle sheet, and these are the vessels. So now I have reached the almost the just 2 centimeter above the inguinal ligament. So these are the femoral vessels or external iliac vessels. This was all about the acute appendicitis. Thank you very much.